So, welcome to our simulation for today. Today we are going to take care of our patient Sam check-ins. And our first thought for today is to remember our simulation guidelines and to think of simulation as a non-threatening learning environment, and therefore your mistakes would be okay. It's okay to have mistakes in this simulation. What happens in this simulation stays in the simulation. I want you to be engaged and to suspend your disbelief and think of this simulation as your real clinical scenarios and real patients that you see in the clinical area. Do you have any questions so far?
No.
Then I would like you to be familiar with the room. Look around you and note what you see, what we have in the room. And I need you to be very familiar and be comfortable with the equipment that you see. So we have our monitor over there, and you will see your patient's vital signs. But you would have to take your patient's vital signs in order for you to see vital signs. Okay? If you don't take vital signs, of course, there are no vital signs. So that's the first step that you need to do in order to get your patient's vital sign. And you will be able to use some of the equipments for taking vital signs. You have your sphygmomanometer, and we have a thermometer in the room. We have it right there. And I suppose you have your stethoscope, and I see your stethoscope with you. We also have a telephone that works. Okay? It really works. So if you need to call any resource from outside, it will work. We do have a directory. Well, of course, there's only one number there, but you need to indicate who are you calling in order for us to be able to provide you with the right information. So if you need to call your doctor or attending physician, if you need to call the lab nutritionist, or even your nurse manager or charge nurse, the phone will work for you. We can also call you here. So if we will have information, additional information, for example, say from the lab, then we will call you in the room and we'll give you the information. So that's your telephone that works. And then, of course, in real clinical scenarios, we are now using our portable computers, or whatever we call them today, cows. Some people don't like to call it cows. And we have that in order for you to be able to access the information of our patient online. So if you open your computer, and for today we're using DocuCare, all the information that you would like to know about our patient is in DocuCare, and it's open for you. Our mannequin, of course, will be able to provide you with a lot of information that you would need for your assessment and communication. Our patient here, Sam, is breathing right now. So you're looking at chest, rise and fall. If you would like to take your auscultate, I should say, your heart sounds, lung sounds, bowel sounds, you can. Our patient will also be able to provide you pulses, so you can actually palpate and assess pulses if you have to. Our patient's also blinking. We will be expected to provide interventions for our patient in this scenario, and therefore you will need to take a look at the medication card before we start the scenario in order for you to get familiar with where things are. And the medication card outside is usually just like any medication card that you would see in the hospital setting, although right now it's probably changing because we have the computerized medications in most hospitals. So for today, we don't have a computerized medication system. We have our traditional medication card outside. Okay, so please take a look at that, the card, explore the card before we start the simulation so you know where things are. We also have a drug handbook. If you are not familiar with the medication that you're going to give, feel free to consult your medication or drug handbook. Okay, and roles. Of course, I know you love to be nurses in simulation. There are two ways that you can do this. I can give you your assignment, you can volunteer, or third way, we can draw lots. How do you want us to do this? I can probably assign, right?
Whatever you want.
Okay, so I have the permission to do that. So I would need a primary nurse for this scenario. And since you're wearing your lab coat and you are wearing your stethoscope, I would suggest you be the nurse for the day.
That's fine.
Okay, primary nurse. Secondary nurse. Okay. And we have primary or patient care technician.
Okay.
We have family member, and we have observer. Okay. So roles, I would like you to stay true to your roles. As a secondary nurse, you are going to give report to the primary nurse, and then your shift is over. So therefore, after giving report, you become an observer. So as observers, I need you to take down notes, very specific notes as to what's going on, what is happening or what are happening in the room, specific assessment activities, interventions, reactions of patients, reactions of family members, and also just overall, what are you thinking? You can also jot down notes of what are you thinking. You think, what do you think is happening right? What do you think is happening wrong? Or what are the things that would have to be improved for the next time? So take notes and write them down if that will help you remember them during the debriefing. So do you have any questions about your roles right now? We will go through the simulation, and we are usually going to, usually we allot 30 minutes for the scenario to run. However, we can also end the simulation depending on whether we see that the objectives are met or not. Or you can end the simulation yourself. So for example, if you are the primary care nurse and you say, everything is done and it's over and bye, okay, I'll see you later. So that also indicates to us that you think that the scenario is over and that you've met your objectives for caring for this patient. So there are several ways to end the scenario. We can end it, you can end it. And so let's review our objectives. So we gave you time to sort of get together earlier in order for you to just share information about the care of a patient with intestinal problems. One of the more common intestinal problems that we have among our patients is small bowel obstruction, or just intestinal obstruction, right? It could be large bowel obstruction, small bowel obstruction, but just bowel obstruction in general. So what do you remember about intestinal obstruction?
It can be dehydrated. It can have fluid electrolyte imbalances, especially potassium, sodium chloride, and just water also.
Okay. And what else would be expected problems of patients with patients who are throwing up, patients who are dehydrated? What else can happen?
Hypovolemic shock.
They can go into hypovolemic shock. Okay. And therefore, as nurses, what do we do? Okay.
You want to hydrate them.
Mm-hmm.
But saline, I'm guessing first, and see how they go and progress slowly.
Okay. So very good. So I see that you have prior knowledge about taking care of patients with these types of problems. So keep that in mind as we go into the simulation and do what you need to do. Right? Very good. Questions? Okay. So are we ready?